The Wegener's Granulomatosis Support Group, now the Vasculitis Foundation, was founded in 1986 by Marilyn Sampson, a registered nurse after her diagnosis of Wegener's. At the time, life expectancy for most patients was 6 months to 2 years. Marilyn created the group to offer hope and educational support to other patients and their families. She wrote the first information brochure and contacted doctors to meet other patients and raise awareness of this potentially life-threatening disease. In 2005, the organization's name was changed to the Vasculitis Foundation, with programs and services expanding to encompass over 20 forms of vasculitis. The Vasculitis Foundation's objective is to improve access to educational resources that will provide greater understanding of vasculitis in both the medical community and with our patients. Greater understanding of the disease in the medical community will ensure patients receive earlier diagnosis and more effective treatment. Greater understanding of the disease process by our patients will enable them to make educated and informed decisions about their treatment. To accomplish this, we must connect patients with medical professionals who recognize the disease. This means we have to raise awareness, not only in the general public, but in the medical community also. The VF partners with patients, family members, physicians, and researchers around the world to advocate for better patient care and greater understanding of vasculitis. The VF website averages more than 12,000 visits per month, and we receive thousands of email and phone requests for information each year. The Internet provides the opportunity for international collaboration on research, patient recruitment, and to advance advocacy efforts. Social media enables our community to connect with other patients to share their experiences and knowledge. In addition, many of the members of our community are engaged in raising awareness of this rare disease. The Vasculitis Foundation is effective because of our dedicated volunteers. We're governed by a 13-member board of directors that are responsible for setting strategic direction and policy for the organization. The Scientific Advisory Board oversees the research program and reviews research applications to ensure content is consistent with defined research goals. Also, the VF medical consultants are recognized worldwide as authorities in vasculitis and are experienced clinicians and researchers. The consultants provide guidance to the VF Board of Directors and staff on developing strategy, setting goals, improving processes, and adding new services to assist our patients. Because so many patients do not receive a correct diagnosis, the Vasculitis Foundation measures its success by the number of patients receiving diagnosis and treatment each year and the number of medical professionals and institutions joining the VF and becoming engaged in the field of patient care and research. We continually engage with other patient advocacy organizations to fulfill our mission. The success of the VF research program is determined by the number of research applications funded each year and the ability of these studies to gather data and provide definitive conclusions in novel areas of interest. The VF is the only international patient advocacy organization for people with vasculitis. Our programs are funded by individuals, corporations, and foundations. We do not currently receive funding from any other source. Every gift made to the foundation goes to help those who have the disease through our programs and services. Through the Vasculitis Foundation's website, newsletter, information packets, and one-on-one support, we educate patients about the disease. Our materials provide the most current information on vasculitis, its symptoms, medications, and side effects. We connect patients worldwide with experienced physicians for diagnosis and treatment, and connect researchers with patients for critical research. Educational meetings bring together our patients, families, and vasculitis experts. These meetings give patients the opportunity to meet others living with vasculitis, often making lifelong connections and friendships. It's a layer of support that is priceless for those living with a rare disease, and therefore our greatest accomplishment. Without a doubt, the single biggest challenge for the Vasculitis Foundation is raising awareness about the disease itself. VF members are encouraged to raise awareness of vasculitis year-round in their local communities. Awareness activities are directed at two constituents, the general public and the medical community. We hope to make the entire medical community aware of vasculitis and to provide them with the knowledge to diagnose and effectively treat the disease. We also hope to make the general public aware of vasculitis so that they may better recognize the symptoms should they appear in their own lives. The Vasculitis Foundation Research Program, established in 2001, funds researchers studying vasculitis. To date, we have funded more than $1 million in research, making us the largest private funder of research on vasculitis in the world. Because of VF-funded research, new and improved treatments and a greater understanding of vasculitis have increased the life expectancy for patients and also improved their quality of life. With additional resources, we could fund more research with the hopes of finding a cure for this disease. We would also fund more fellowships to train physicians wishing to gain clinical and research expertise in vasculitis. Additional funding is critical to the Vasculitis Foundation because without it, patients will not receive the information they need to successfully manage their disease. We are a partner to their medical team, providing them with support, information, connections, and sometimes just a listening ear. With additional funding, we could reach more patients and more professionals. We could hold more educational meetings for patients and for the doctors that treat them. We could make disease-specific information available in more languages. We could create programs that specifically target the pediatric and elderly populations. With more funding, we could save lives.